Perfect. All right, so hi everyone. Welcome to this webinar on osteoporosis. My name's Bree. I'm the Health Promotion Coordinator at Arthritis Queensland. And today we'll be discussing what osteoporosis is, the risk factors in diet and lifestyle behaviours, and the importance of monitoring your bone density, as well as discussing ways to keep your bones healthy and strong for the prevention of falls, fractures, and also healthy aging. So just a little disclaimer here. So this presentation contains general information and advice. So every effort we've made to make sure that it is accurate and reliable, but don't use this information as a substitute for individual treatment or advice. So make sure you always go to your doctor and healthcare team to get that individual medical and treatment advice. Sorry, just let these people in. All right, so in the spirit of reconciliation, Arthritis Queensland and New South Wales acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So today we'll be covering a few different topics around osteoporosis, such as what it is, also the 3 pillars of bone health and what that means. Also, we'll go through some of the most common medications for osteoporosis and some tips on fall prevention. Okay, so what is osteoporosis? So osteoporosis is a really common disease and it does affect over 1 million Australians. So this disease makes bones become brittle and it leads then to a higher risk of breaks than in normal healthy bones. So osteoporosis occurs when bones lose minerals such as calcium more quickly than the body can replace them. So this causes a loss in bone thickness or density, and it causes our bones to become really brittle and susceptible to fractures. So in a normal healthy bone, the mechanisms that drive bone remodeling are homeostatic. So this means that the bones that break down are being built back up again at the same pace. So there's no loss of bones. So they actually remain the same strength. So osteoporosis is diagnosed with a bone density scan, or commonly known as a DEXA scan. And this will actually test and show if your bones are either in the range of 1, which will be normal, 2, which will be a low bone density, and this is called osteopenia. So this is before osteoporosis. And then the third one is osteoporosis. So this is a picture of a normal bone here and then a bone with osteoporosis. So bone health is a really, really important part of our general health. So bones are flexible yet strong for movement and they protect our vital organs. So our bones grow when we are children and they have a growth spurt during adolescence. So bones are constantly being rebuilt during adulthood, and this process is called remodeling. And we spoke about that in the previous slide. So when the structure of a bone is compromised and becomes weaker and less dense, the bones have an increased risk of breaking. And that's what you can see in this picture here. So in this picture, you see the difference between a normal bone and an osteoporotic bone. So the bone with osteoporosis is thinner and weaker, and it becomes less dense. The bones are fragile and brittle, and they are able to break more easily. And then with osteoporosis, any bones can become affected. So osteoporosis is a silent disease. So there's no signs or symptoms until a fracture occurs. And research has shown that the most common sites where broken bones occur are at your hip, they're at your wrists, and in your spine. So, and some other common sites include our ankles, our legs, our forearms, and our upper arm and ribs. So these these fractures typically occur after just a minor trip, or if you have a fall or a similar incident like that. So osteopenia, which we mentioned before, so this is a clinical term that's used to describe a decrease in our bone mineral density. So osteopenia is quite normal in aging, just like our wrinkles and our grey hair. But so, for example, you can get creams for your wrinkles, or you can put sunscreen on and wear a hat, and that will reduce the severity of them. So there are some things that we can do to help that slow natural process. So these, but when we do have these outstanding hormonal changes, or we have long-term dietary and physical activity concerns, or we have other medications and other comorbidities added into the mix, our density of our bones can be more affected than usual. So it's important to be aware about what osteoporosis is and how you can get diagnosed if you suspect it. So now we're going to touch on some of the modifiable risk factors. So when I say modifiable, this means that these are risk factors that we can change. So the first risk factor that we can change is our low calcium intake. So adults require on approximately 1,000 milligrams daily, and that's preferably through our diet. And this does increase to 1,300 milligrams daily for women over 50 years of age and men over 70 years of age. The next one is low vitamin D levels. So vitamin D is needed to absorb the calcium in our body. So having a lack of sun exposure can lead to low vitamin D levels. So people who are at risk of vitamin D deficiency should go see their doctor and get tested. The next one is physical inactivity. So a sedentary lifestyle, so little exercise, little movement, encourages the loss of bone mass. So exercising regularly can reduce the rate of bone loss, and it can also work towards strengthening our bones as well when we exercise. And then there's unhealthy lifestyle behaviours, and these include smoking and excessive alcohol intake. So long-term alcohol consumption can interfere with bone growth and remodeling, and this can actually result in a decrease of our bone density and an increased risk of fracture. Tobacco smoking also causes an imbalance in the mechanisms of bone turnover, so it can actually lead to reduced bone mass and reduced bone mineral density when we smoke. So this can make our bones really vulnerable to osteoporosis and fracture. And also our weight. So even having a thin body build can increase our risk of osteoporosis because we might not be getting enough calcium in that in. And then also obesity studies suggest when we are obese, it can change our hormones in our body, which can impact our bone health. All right, so now we're going to touch on the non-modifiable risk factors. So these are the risk factors that unfortunately we cannot change. So the first one is our age and gender. So women naturally have much smaller bones with a thinner cortex and a smaller diameter. And because of this, we are more vulnerable at developing osteoporosis. So men do have a higher peak bone mass, but they're also at risk of osteoporosis, and this is seen after the age of 70 years. And that's when our bone loss and fracture risks increase significantly. So women do start losing bone at an earlier age and a much faster rate than men. Women over 50 years of age have a 4 times higher rate of osteoporosis and a 2 times higher rate of osteopenia. And they tend to have fractures 5 to 10 years earlier when compared to men. The next one is our family history. So poor bone health can be hereditary. So check if anyone in your family, particularly your parents or siblings, and if they've have been diagnosed with osteoporosis. So this can include your parents or brothers and sisters who have had a broken bone from a minor fall, or if they've rapidly lost a lot of height, and that can indicate that they're at risk of osteoporosis. And then there's medications. So there are certain medications that can increase our bone loss and impact our bone health. And these can include medications such as corticosteroids, which can be used to help with arthritis, pain and inflammation, as well as blood thinners such as warfarin, and then some cancer drugs, including breast cancer and prostate cancer. So some other health conditions can also impact our bone health, and these include celiac disease or inflammatory bowel disease and other malabsorption disorders, and then also diabetes and anorexia nervosa, as well as endocrine and hormonal diseases and certain cancers. So all of these health conditions can impact our bone health. And then the last one is our hormone levels. So early menopause in women can result in low hormone levels, as well as low testosterone in men. So all these low hormone levels can impact our bone health as well. So who gets osteoporosis? So this picture here indicates the ages where we have bone growth and bone loss. So as you can see during childhood and adolescence, these are really, really significant years that we need where our bone growth is occurring. So that's right up to 30 years of age, and it's very critical for our bone growth. So the term peak bone mass means the highest level of bone density and strength, and that's typically seen here in 30 years of age, and that's reached by the age of 30. So afterwards, after the age of 30, our bone density gradually decreases, so that's slow loss there, and that's between the ages of 30 and 50 years. And then after 50 years, bone loss often accelerates after menopause in women, and then in aging in both genders. So it's super important that we build really strong, healthy bones during our youth, as it's vital to ensure a better bone health later in life. So the key message from this picture is that women over 50 years of age are at greater risk of developing osteoporosis. And why is that? So as mentioned earlier, we have lower bone stock than men in the first place. And then there's a rapid decline in the production of estrogen after menopause. And that's particularly seen in the first 3 to 6 years post-menopause. So estrogen is really important in maintaining those healthy bones. So when our estrogen levels decrease, our bones lose that calcium and other minerals at a much faster rate. So men also lose bone as they age, and that's through decreases in hormone levels, but their bone mass generally remains quite good until much later in life, and that's seen around the 70 years of age. So why should we worry about osteoporosis? And the reason is if we have osteoporosis, it does increase our risk of having a fracture and breaking bones. So osteoporosis weakens our bones, which we saw in that picture, in that diagram, and it makes them more susceptible to fractures, and that's especially seen in our hip, our spine, and our wrists. So these fractures can result in chronic pain, disability, and a loss of independence. So if you've been diagnosed with osteoporosis, it doesn't mean that you definitely will have a fracture, but the level of risk is much higher than a person who doesn't have osteoporosis. So once you have one fracture, you are much more likely to have another one. So for example, women who sustain a fracture in their spine are 4 times more likely to have a second spinal fracture in the same year compared to other people who have not had an osteoporotic fracture before. Also, half of all women and 1/3 of all men over 60 years will have an osteoporotic fracture. And this is why it's really important to identify and treat osteoporosis fractures as soon as possible. So, diagnosing osteoporosis. So, to get that diagnosis, your GP will provide you with a referral after a really thorough health history and risk assessment check. So, they actually send you off to get a bone density test or a DEXA scan. And the DEXA scan is a really simple scan that will measure the density of your bones at the hip and spine. It's really quick and it's a painless procedure. You just simply lie on a flat padded table and the arm of the machine will pass over your body and the scan will take approximately 10 to 15 minutes. You remain clothed during the scan. So the results of that test will be sent to your doctor and your doctor will go through it with you. So women and men over 50 years with risk factors for osteoporosis will need a bone checkup with a DEXA scan. So younger adults with risk factors may also require a test as determined by their doctor. So a DEXA scan will determine if any action is needed to protect your bone health. And the result will commonly be referred to as a T-score, and it will indicate whether you're in the range of normal, low bone density or osteopenia or osteoporosis. So we're actually going to have a look at what these T-scores look like. So sorry that the normal range is a little blurry, but if you do score between that 1 to -1, so that means that you're in that normal range, and it's great. So you can keep up the adequate calcium, the vitamin D levels, and regularly exercising, and these will help maintain your healthy bones. If you do score in the -1 to -2.5, this is osteopenia. So this means you have lower than normal bone density. Sorry, you can probably hear my dog barking, apologies. So this means if you score between -1 and -2.5 that you have osteopenia. And the outcome is to take immediate action to minimize further bone loss by checking your calcium and vitamin D levels. So a DEXA scan will be done after 1 to 2 years just to recheck your bone density levels. And then the next one, if you score between -2.5 or lower, that does mean osteoporosis and the fracture risk is really high. So your doctor will start treatment with medicines and make sure your vitamin D and calcium levels are adequate. So there'll be follow-up tests to monitor your bone health and treatment. So now we're going to move over to the 3 pillars of bone health. So these include our calcium levels, our vitamin D levels, and also exercise and how these can all help our bone health. So calcium, what is it? So calcium is a chemical element. So 99% of our body's calcium is actually, 99%, sorry, of our body's calcium is actually stored in our bones. So it does combine with other minerals such as protein and collagen to give our bones that structure and strength. So why is it important? So calcium is really, really essential for building and maintaining healthy bones throughout life. So a small amount of calcium is absorbed into the blood and used for healthy functioning of our heart, our muscles, blood and nerves. So our bones act like a calcium bank. If there's not enough calcium in your diet, the body will take what is needed from our bones and actually use it for other parts of our body. And if this happens, your bone density, so our bone strength, this will actually decline and you may be at risk of developing osteoporosis. So that's why it's really important to get enough calcium in our diet every day. So how much do we need? And we'll actually go into detail on this in the next slide. But did you know that less than 50% of Australian adults get the recommended intake of calcium? So our calcium intake does change over the years. So it increases from birth to peak adolescence, just like we saw in that picture. And then our second peak of the highest intake does come when women turn over 50 years of age and men are over 70 years of age. So dairy is our main source of dietary calcium, but we can actually get it from other sources too. So calcium, how much do I need? So as you can see here in the table, children, they start off at 500 milligrams to the age of 3, and then that gradually increases until they hit at teenagers. So between the ages of 12 to 18, they need a daily intake of 1,300 milligrams. And this was seen in that picture where you do have that growth and you need as much calcium as you can, because that's going to set us up for really healthy bones later in life. So once we hit 19, it goes to at least 1,000 milligrams a day, and that's right up till about 50 years. And then once women are over 50 years, we need at least 1,300 milligrams, and that's because of menopause and hormonal changes, and we start to gradually lose our bone density. And with men, they don't need 1,300 milligrams until they're over the age of 70. So we're going to have a look at what 1,300 milligrams looks like in food sources. So 1,300 milligrams of calcium, that does equate to 3 serves of dairy. And what 1 serve of dairy is equivalent to is 1 serve is a cup of milk, so 250 mils, or it is 2 slices of hard cheese, so that is about 40 grams, or it is 3/4 a cup of yogurt, so 200 grams, or half a cup of ricotta cheese, so 120 grams. So to put that in what that looks like in a day's worth of calcium. So if you have, you get up in the morning and decide to have breakfast cereal or porridge, you could add that 1 cup of milk with your cereal or porridge. And then for lunch, you might have a salad sandwich and add in your 2 slices of hard cheese. And then as an afternoon snack, you might have, your 200 grams, so 3/4 a cup of yogurt and fruit. And that does hit 1,300 milligrams of calcium for your day. So it doesn't, when you put it in perspective like that, it's not actually that much when you think about 2 slices of cheese, a cup of milk, and, 3/4 a cup of yogurt. And you could probably have a cup of milk in all your cup of teas and coffees that you have during the day as well. So it can be quite easy to hit that 1,300 milligrams. So those 3 serves of dairy. But for those who cannot consume dairy because of intolerances, or they don't wish to have dairy, some other calcium-rich food options include, you've got your tofu, and then you're also your tinned sardines or tinned pink salmon. These actually have little edible bones in them that are really, really rich in calcium. So they actually hold quite a lot of calcium if you have these tinned fish. And then there's almonds with skin on, as well as broccoli and leafy greens. And some other ones are dried figs or your watercress vegetables, celery, and then also your tinned beans. So you like your baked beans or your chickpeas. They actually have a bit of calcium in them as well. And then I know for me, I drink specialty milk, so almond milk. So almond milk, soy milk, and oat milk. So these options, you can actually get them fortified with calcium. So there's actually products out there that will have these specialty milks, but add extra calcium in it. So if you do drink specialty milks, opt for the ones that are fortified with calcium. So you can actually just check it on the nutrition panel on the side of the milk, and it will show you how much calcium's in it, and it will usually have your recommended daily intake in it as well. So here are some other food examples and their calcium content. So as you can see, dairy foods are the richest source of calcium with up to 305 milligrams per serve. And then that's followed by seafood. So your canned sardines and salmon. So it does have a lot of calcium per serve as well. And then, you know, your leafy green vegetables are also another rich of calcium with up to 250 milligrams per serve. And then that's followed by your eggs, your tofu, your canned and tinned beans, as well as some other meat options can have up to 105 milligrams per serve. All right, so now let's discuss vitamin D. So why do we need vitamin D? So we need vitamin D daily because it's really essential for bone health, and it actually helps absorb calcium, and it helps control the level of calcium level in our blood. So the best place, where do we get it, is actually produced. So vitamin D is produced when our skin is exposed to ultraviolet B, so UVB light that comes from the sun. So limited sun exposure is needed to produce adequate levels of vitamin D. So exposure times vary based on where we live in Australia and what season it is. But for most people, sunshine is our main source of vitamin D, and that's specifically the UVB light, and that helps us synthesize vitamin D in our skin. So how much we need depends on where we live and the season and our skin type, but it can range from 5 minutes to 3 hours per week. And we'll go into more detail of this in the next slide. But we need to really remember to balance the amount of sunshine for bone health with the need to protect the skin from damage from overexposure, and especially if you live in Queensland like me. So what is low vitamin D? So low vitamin D levels should be avoided by getting some safe sun exposure. So low vitamin D levels are considered anything below 30 nanomoles per litre, and they require immediate attention. So very low vitamin D levels or severe vitamin D deficiency is even lower and can usually be corrected with supplementation. So vitamin D levels of 50 nanomoles per litre is sufficient, and it's common to have really high levels of vitamin D throughout summer, and they may range from 60 to 70 nanomoles per litre as well. So doctors will test vitamin D levels in people with risk factors for vitamin D deficiency. And low vitamin D levels can cause other health issues, and this could be they can stop the absorption of calcium consumed, which can impact our bone health. It can lead to issues during pregnancies. It's linked to depression, and in severe case, rickets. So as you can see on this map here, for recommended sun exposure for vitamin D based on the location with Australia, so people here in Brisbane in Queensland, they just need a few minutes per day on most days of the week, and that's all year round. So in Sydney, people just need a few minutes on most days in summer. So right here, just a few minutes on most days in summer. And then in winter, so June and July, they need 2 to 3 hours per week. So there's actually quite a big difference there on sun exposure. And you can see that for each of the states. And it has each month, which is the best month to get, you know, those the vitamin D. So it does change throughout the year, and our levels, as I mentioned before, will be highest at the end of summer and lowest at the end of winter. And Healthy Bones Australia, which is a really fantastic organisation to get all the information you need for your bone health, they recommend a vitamin D level for at least 50 nanomoles per litre at the end of winter. And during summer, higher levels are common in that 60 to 70 nanomoles per litre. So your doctor will only test your vitamin D level with a blood test if you're at risk of vitamin D deficiency. And some of the people that may be at risk of vitamin D deficiency include adults who mainly spend their time indoors due to health or work. Sorry about that. pro, everyone. Also, people who avoid the sun due to skin protection or based on medical advice from their doctor. People with medical conditions that can impact the ability to absorb or process vitamin D. People who are elderly or housebound or in residential care that don't get enough sunlight. And also naturally people who have darker skin. So darker skin reduces the penetration of that UVB light as well. And also people that cover their body for cultural or religious reasons, and also people who are pregnant or breastfeeding. So all of these people can be at risk of vitamin D deficiency.
Muscles, shouts, salmon, oysters, bok choy, and leeks.
I'm just going to mute. So vitamin D, what if I'm not getting enough? So over 30% of Australians have vitamin D deficiency. That's, almost 1/3 of Australians. So in older people, vitamin D deficiency increases the risk of falls and fractures. Vitamin D deficiency can also cause our bones and bone and joint pain, and also cause our muscles to become weak. Supplementation may be required, and it can be done in multiple forms. So there's tablet forms, capsule forms. It could come as a drop or also in liquid, and your doctor will prescribe dose on an individual basis. So if you do think you're at risk of vitamin D deficiency, go in and have a chat with your doctor and get some blood tests done to check your levels. So exercise. So exercise is one of the most effective lifestyle strategies to increase bone strength and reduce the risk of falls and fractures. So did you know hip fractures are 30 to 45% less frequent in adults who are physically active? So exercise is essential at every age. So in children, exercise increases bone strength. In adults, it maintains that bone strength. And then in older adults, it increases balance, it increases coordination, which helps reduce the risk of falls, which in turn reduces the risk of fractures. So what exercise should I do? So the best type of exercise for bone health is those weight-bearing exercises. So these exercises can require some impact. So you think about jogging, running, or sports like tennis or netball, and then those exercises where extra load is added. So I know a lot of people out there will be unable to do running or jogging or any of these sports due to their arthritis and other reasons. So it's really important to go see an exercise specialist, such as an exercise physiologist, because they can actually prescribe you with specific exercises, such as resistant training with weights, and also in the form of functional exercises. And they can ensure you are doing appropriate exercise to maintain or strengthen your bone health, and also to suit your ability and arthritis condition. And they can actually supervise you while you're doing it, so it's proper form and proper technique. So why is exercise important? So to increase or stimulate bone growth, there's a Wolff law out there that states that bone in a healthy person or animal will adapt to the loads under which it's placed. So that means more load, more impact will actually stimulate bone growth and actually help build our bone density back up. So how much is needed of exercise? So the Healthy Bones Australia, they recommend minimum 3 times a week, and that can range from 30 to 60 minutes of impact or strength training. And then also include 30 minutes at least 5 times a week of that low to moderate physical activity, which can include walking and all of that sort of stuff. So with exercise, it's important to note that exercises that don't place stress on the joints equals no bone strength. So only specific forms of exercise will improve bone strength. So this means exercise done on your feet. So you bear down on your own weight, which jolts bones rapidly and firmly. So examples include jogging, dancing, impact aerobics, as well as resistant training and stair walking. So what we mean by resistant training is when you use hand and ankle weights and gym equipment such as training with weights, dumbbells, like all of those sort of stuff, kettlebells, and that this training with weights progress in intensity over time. So this places stress on your bones, which increases our bone strength. So some of these types of exercises can be difficult for your arthritis, and it might be quite difficult to complete these exercises. So it's really important, as I mentioned earlier, to speak with an exercise specialist, such as an exercise physiologist, and do get these specific exercises and training developed for you. So as I mentioned earlier, bones need that certain amount of stress to become stronger. So this is why resistant training exercises, jogging or stair walking, these are recommended as they place that stress on your bones, which creates them to become stronger. Unfortunately, walking is not enough to place that necessary strain on your bones that is recommended, but keep walking because it's absolutely fantastic to keep healthy, especially cardiovascular health. But for bone strength and bone health, also include other exercises into your daily regime, such as weight-bearing exercises. So exercise and related osteogenic capacity. So the ability of a form of exercise to cause bones to strengthen is called osteogenic capacity. So low osteogenic exercises, see here, is walking, lawn bowls, yoga, Pilates, and Tai Chi. And then you have the moderately osteogenic exercises. And these include running or jogging, brisk walking, hill walking, resistance training, and also stair climbing. And then you've got your high osteogenic exercises. And these include the sports like basketball, netball, aerobics, dancing, which is a great one for everyone out there that does dance moves, as well as gymnastics, tennis, and jump rope. And then you've got your non-osteogenic exercises, so cycling and swimming. But it's really important to note that these exercises that are low to no osteogenic benefits have a huge range of health benefits, and you should definitely still do them as part of your exercise regime. But you just want to include some of these moderate to high osteogenic exercises into your weekly exercise regime. All right, so exercise guidelines. So if you can, build up to exercising 3 times per week. And you may ask, what if I can't do that much? And some people out there find it really handy to actually reduce the length of the session rather than the number of sessions per week. So instead of doing, the 30 minutes of this session, reduce it down to 15 to 20-minute sessions, but still do it 3 times per week. In those 3 sessions per week, try and do exercises that continue to be challenging. So this is known as progressive resistance training. So this will help increase your bone density. And another good point is to vary your exercise regime to continue to challenge your muscles and bones. So it's good to try different exercises, different weights, and changing up the exercise routine. But keep in mind just to do what you're able to do. And exercise sessions or exercises that are short, intense bursts are better than one long session to build bone health. And they also burn more kilojoules and increase our endurance and strength. All right, so here are some additional exercise guidelines. So for healthy bones, a recommendation of completing a mix of weight-bearing exercise with supervised progressive resistance training and also challenging balance and mobility exercises. So completing all of these at least 3 times per week. Also be aware of that forward flexion exercises, such as bending over whilst holding an object or doing those sit-ups with straight legs, and also that twisting movement of your spine. It may increase risk of spinal fracture. It's just something to be really aware of if you already have osteoporosis in your spine. And also, moderate to high impact activities are only recommended for people with osteoporosis who do not have a previous fracture or lower limb arthritis. So make sure you consult with your doctor or exercise physiologist or even physiotherapist for more advice. And these guidelines are specifically taken from the Healthy Bones Australia website. So you can see down here. And so you can visit their website, or you can actually call them on their infoline number, which is 1-800-242-141, and get more detailed advice, as they have a whole page full of exercises on it for people with osteoporosis or people that want to strengthen their bones. And it was being collaborated with Exercise and Sports Science Australia. So that's really worth checking out and having a chat with them for more advice on exercise guidelines. So the exercises, do's and don'ts that are recommended by Healthy Bones Australia and also Exercise Sports Science Australia. So they do recommend to include a variety of activities. So incorporate progression resistant training. So that starts out with supervision if you are new or restarting after a break of exercise. So that could be done with an exercise physiologist and just work on that resistance training and having them supervise you just to keep on top of your form and making sure you're doing everything correctly. Also to exercise at least 3 times per week and get that professional advice. And this will just help reduce risk of injury or hurting yourself as well. So for the don'ts, so don't stay inactive for long periods. It's really best to keep moving, strengthen those bones, and also keep those joints healthy with your arthritis. And also limit that forward flexion of the spine or the twisting of the spine if you already have osteoporosis, as it may lead to a fracture. So medications, so we're going to go through some of the medications that may be used for osteoporosis. So if you have osteoporosis or you are at high risk of a fracture, your doctor will prescribe medications to reduce your risk of a fracture. So in Australia, there are a range of treatment options available. You and your doctor will determine the best treatment for you, and that will take in consideration other medical conditions. So osteoporosis medicines can increase bone density, and while the increases may appear small, this can have a very positive effect on reducing fracture rates. So for example, medications can increase bone density in the hip by approximately 1 to 3%, and in the spine by 4 to 8% over the first 3 to 4 years of treatment. So medications can therefore reduce spinal fractures by around 30 to 70% and hip fractures by 30 to 50%. So you will start to see a positive effect as early as 6 to 12 months after starting treatment. So in Australia, there are a range of treatment options available, and you and your doctor will determine the best treatment for you. So this will take in consideration other medical conditions that you may have and other medications that you're on for it as well. And your doctor can also advise you if your medication is subsidized by the pharmaceutical benefit scheme. But just have a chat to your doctor for more information. So here are some example medications that may be prescribed by your doctors. So the first one is bisphosphonates. So these are a group of drugs that work by slowing bone loss. So they reduce the risk of hip and spine fractures. Bone renewal is a really, really slow process. So in many people, an increase in bone density can be measured over 5 years of treatment. So these medications are used to reduce the risk of hip and spine fractures if you have osteoporosis, and it can actually be taken orally, like in a tablet form, or done through a drip, which could be an intravenous infusion, or also by injection. And then the next one is, I can't pronounce it, sorry, but this injection is used to treat osteoporosis. So it is given when other medicines cannot be used or after other medicines did not work well. So it works differently than the bisphosphonates, but it does achieve the same outcome. So this medication is recommended for osteoporosis in post-menopausal women who could not take the bisphosphonates. And it's also recommended in men who have developed osteoporosis as a result of prostate cancer. So the next one is calcium supplements. So calcium supplements with a combination of vitamin D is recommended for elderly people. And this is particularly those in residential care facilities, and it helps reduce the risk of falls and fractures. So a 500 to 600 milligram of supplement dose daily when required may be suggested by a doctor. And then the next one that's not on the screen is also hormone replacement therapy. So this is a medication that mimics the female hormones, estrogen and progesterone, and it can be used to help manage symptoms of menopause and also strengthen bones. So all medications work differently, but the main common theme among them is that they aim to increase our bone density. So I thought I'd mention that a 2016 meta-analysis research paper showed that a significant 15% reduced risk of total fractures and a 30% reduced risk of hip fractures was seen when using the calcium plus vitamin D supplement. So it's actually works really quite well at reducing fractures. So I thought we'll go through some fall prevention tips, and it's really important that we reduce our chances of having a fall and causing an osteoporotic fracture. So some of the key points to help prevent a fall are to stay active and improve your balance and strength. So have your medications reviewed on a regular basis by your doctor and specialist. Also, you have your vision checked at least every 2 years, and always wear appropriate footwear. So go see a podiatrist if you're having foot pain and issues, and they can actually help you be fitted properly for shoes as well. Make sure you eat well and stay hydrated, as dehydration can lead to dizziness, which can impair your ability to walk. And make sure you go and improve the safety in and around your home. So you can actually get an occupational therapist to come visit your house, and they can do an assessment. They can also provide some suggestion on assisted devices in and around your home for you to be able to get around nice and easily. And finally, be aware of potential hazards in your community. So these can include holes in the footpath or cracks in the footpath, and these can cause you to trip and fall and hurt yourself, and may lead to a fracture. So it might be useful to use an assistive device if you need to, and that can help you feel steady when you walk. So using a walker or cane or a walking stick can help prevent falls. And if your doctor tells you to use a cane or walker, just make sure it's the right size for you and you can walk comfortably with it. And finally, some tips on getting the most from your healthcare team appointments. So first one is prepare and educate yourself. So go in with a list of questions you want answered. And it's best to go prepared, as you may forget to ask something and you don't want to have that. You want to have all your questions answered. Ask these questions, and especially if you don't understand something, their suggestions, ask those questions to understand the advice. And make sure you write down important information. So take a pen and paper and take some notes if you can. Make sure to find out where you can get more information, and also keep your healthcare team informed. And that's especially if you've had a fall or something just doesn't feel right. And that is it. All right, so I am just going to stop the recording.